My name is Dr. Alex Solchinsky, and I'm a double board certified facial plastic surgeon. Welcome to our video blog. Today I'll be talking to you about the bulbous tip. The bulbous tip is an issue that many patients complain about. It implies the tip of the nose, this area of the nose, being too fat or bulbous. There are three different types of bulbous tips. The first type, the most common type, is the ethnic bulbous tip or the fibrofatty bulbous tip, where the bulbosity of the tip is primarily made up of fibrofatty tissue under the skin and also a thick layer of skin on top of the fibrofatty tissue, in addition to weak nasal cartilages. In this type of a bulbous tip, the treatment or improvement of the bulbous tip is through an open rhinoplasty approach to remove the fibrofatty tissue underneath the skin in order to thin the skin, and also to build up cartilage grafts so that they can show through the skin. So essentially what we do is remove the fibrofatty tissue, use septal cartilage or ear cartilage grafts to build up the nasal tip, and then close the nasal tip. This is a common procedure in ethnic rhinoplasty patients. The second type of bulbous tip is typically seen in Caucasian patients, where you have the skin is typically thin. However, there's an overgrowth, an overdevelopment of the lower lateral cartilages, which are the cartilages in the tip. And in that case, through an open rhinoplasty approach, the bulbosity of the tip cartilages can be reduced or essentially reshaped. This implies that the tip cartilages will be reshaped and also resupported using some cartilage grafts. It's not necessarily removing cartilage, but more of reshaping it. Once the new shape is formed, the skin is put back into place and the open rhinoplasty is closed. The third type of bulbous tip can be seen in patients that had previous rhinoplasties, and this would be common in revision rhinoplasty patients, and that is either in ethnic patients or Caucasian patients. The iatrogenic bulbous tip is typically scar tissue within the tip. So in those bulbous tips, you could have scar tissue, you could have fibrofatty tissue, thick skin, or an over-excessive amount of cartilage put in or even removed. And those revision rhinoplasties are a little more difficult because of their revisions. The nasal tip is opened, the scar tissue is removed, and the cartilage also has to be reconstructed. Thank you very much for watching this video blog.